Welcome to the Department of Social Services HIPAA and Confidentiality module. In this course, you'll learn about HIPAA and the different rules that affect our work with Missouri citizens, the different DSS policies that will guide you as you work with our various clients and applicants, the rights that clients have regarding their confidential information, and what to do in the event of a breach, as well as the enforcement of HIPAA and the consequences for violating its requirements. To get started, simply click on one of the learning objectives listed on your screen. Once you've completed all 4 objectives, you'll complete a quiz. In order to pass this training, you must score 80% or higher on the quiz. So let's get started. HIPAA privacy and security rules. In this section, you'll learn what protected health information, or PHI, and personally identifiable information, or PII, are, and examples of each. You'll also learn what HIPAA is and how HIPAA affects DSS. What is HIPAA? HIPAA is the Health Insurance Portability and Accountability Act. HIPAA establishes privacy and security standards to ensure that confidential information stays protected and to provide individuals with certain rights to their health information. The Medicaid Health Insurance Program is a health plan. Health plans are covered entities under HIPAA. Why does HIPAA apply to the Department of Social Services, or DSS for short? The HIPAA law and regulations apply to the DSS and its workforce members because we operate Missouri's Medicaid program known as MoHealthNet. DSS workforce members include employees, volunteers, contractors, trainees, interns, and other persons who are in a DSS facility or access DSS information systems. DSS staff may handle client-protected health information, or PHI, and personally identifiable information, or PII, in their job duties to serve our clients and/or individuals. The HIPAA privacy rule sets national standards for when protected health information, or PHI, may be used and disclosed. The privacy rule provides individuals important rights with respect to their protected health information, such as the right to view and request a copy of their information. The HIPAA privacy rule permits the use and disclosure of an individual's health information needed for patient care and other important purposes. The HIPAA security rule sets the standards for protection of PHI in an electronic format known as ePHI and outlines security procedures to maintain ePHI that we create, maintain, or transmit. It also establishes the standards to protect against any anticipated uses or disclosures of information that's not permitted or required under the privacy rule discussed earlier. HIPAA is mandated by the federal government. Why is HIPAA compliance important? It's important to protect the confidential information that DSS is entrusted to handle as we work with Missouri citizens. But also, there are consequences for the department and for individual employees if PHI is disclosed improperly. Failure to comply with the privacy and security provisions detailed in this training and in the DSS administrative policies mentioned may lead to civil penalties and fines for DSS. Employees who fail to comply with any HIPAA-related DSS policy are subject to disciplinary action up to and including separation and/or termination. HIPAA also sets forth criminal and civil penalties for violations. These penalties can include fines up to $250,000 and incarceration for up to 10 years. DSS is considered a covered entity under HIPAA because we operate Missouri's Medicaid program, known as MoHealthNet. Because DSS operates Missouri's Medicaid program, all DSS workforce members are required to comply with HIPAA rules and regulations. DSS workforce members, which includes employees, volunteers, contractors, trainees, interns, and other identified persons, handle confidential health information and personally identifiable information in our service to individuals and clients. Because we are a covered entity and because we handle PHI and PII, DSS is required to comply with HIPAA rules and regulations. PHI is the individually identifiable health information kept or transmitted by a covered entity like DSS. PHI, including genetic information, whether spoken or recorded in any form, is information that relates to the individual's physical or mental health condition. This includes past, present, and future conditions. Relates to the provision of health care to the individual. Relates to the payment for health care services for the individual, including past, present, and future payments. PHI is information that can be used to identify someone. So let's think of all the ways that people can be identified. Someone's name, for instance, and a social security number can be used to identify someone. a full date of birth, an email address, an account number, a department client number, also known as a DCN, as well as a telephone number or billing address, and even a photo of someone's face, unique scars, tattoos, or biometric identifiers, including finger or voice prints, such as recordings of someone's voice, can be considered PHI. If you are unsure if a piece of information is PHI, please contact your supervisor or division's privacy officer. A list of each division's privacy officer and their contact information can be found in the Resources tab of this course. PHI becomes ePHI when it is in an electronic format. Examples of ePHI that DSS workforce members may handle are medical records, billing records, enrollment, payment records, and health information found in case files, just to name a few. We've spent some time going over PHI in the previous slides, but DSS workforce members will also encounter PII, or personally identifiable information, in the course of their duties. PHI is covered under HIPAA. PII is covered under different state and federal privacy laws from HIPAA, not by HIPAA itself. How do you know whether a piece of confidential information is PHI or PII? It's all in how it's used. PII is information that may not be associated with health information, but can be used to directly identify someone, such as their name, social security number, date of birth, and more. PII can also be information that, on its own, may not identify someone, but when combined with another piece of information could reasonably identify a specific person. DSS Administrative Policies. In this section, we will go over the different DSS policies that will guide you in how to safeguard DSS client and applicant PHI and PII. DSS workforce members are responsible for protecting our clients' and applicants' PHI, PII, and records. DSS Administrative Policy 5-103 provides specific directions on how DSS workforce members use and protect PHI. This policy says client PHI and PII is only to be released to authorized individuals or agencies, and that workforce members use only the minimum necessary confidential information to perform their job duties. To view the policy in full, click on the button at the bottom of the slide. DSS Administrative Policy 5-103 applies to the handling of PHI and PII when providing services to our clients and/or individuals. This specific policy does not apply to workforce members' information obtained for employment purposes, such as requests for accommodation, application for leave, or filing a workers' compensation claim. Let's talk about privacy best practices and what to avoid in order to protect PHI and PII. First, avoid conversations about clients in public places. Return PHI and PII to its appropriate location or destroy it properly. Dispose of client information by shredding it or putting it in a locked box for destruction. Be sure to notify your supervisor and divisional privacy officer if PHI or PII is ever inappropriately accessed and/or shared. If you are unsure about sharing a specific piece of information, please contact your divisional privacy officer for assistance. A list of the divisional privacy officers and their contact information can be found in the Resources tab of this course. Don't have treatment or coverage discussions with clients in public areas. Don't leave medical records or client information on printers, fax machines, or other public places. Don't throw away PHI or PII in the trash can. This information must be shredded properly per Policy 5-104 or placed in the locked and secure shred box. Don't use social media messaging groups or post or discuss any DSS-related issues to social media accounts. HIPAA requires DSS to implement technical and physical safeguards to protect PHI and PII. Administrative Policy 6-100 details the security safeguards that DSS workforce members are to use. These safeguards are access controls, password controls, email security, virus and malicious software protection, facility access, workstation use, and media storage and disposal. The picture shows one of the daily access controls that you encounter as a workforce member. You can read Policy 6-100 by clicking the button at the bottom of the slide. Let's talk about some of the different access controls that you will encounter as a DSS workforce member. Under HIPAA, DSS is required to have access controls in place to restrict workforce members from unnecessarily accessing confidential information. DSS has implemented the following access control measures to comply with HIPAA and to protect PHI and PII. Security access request forms must be completed and submitted. Access request forms must be approved by the Divisional Security Officer. Only the required minimum access to PHI and PII will be granted to staff. Automatic system locks have been put in place. Multiple DSS systems require a password, and each workforce member sets their own password. So let's go over password best practices and what to avoid. Change your passwords immediately if there is a chance that your password has been compromised. Report if someone has used your password to gain access to DSS systems to the DSS Help Desk at 573-751-3811. Do not disclose your passwords to anyone. Don't write your passwords down or record them. Be aware of your surroundings and avoid entering your passwords in clear sight of others. Don't use pre-recorded keystrokes to enter passwords. Don't use passwords that could be easily guessed. Encrypting an email converts an original message into unreadable text. An encrypted email makes it unlikely anyone other than the receiving party who has the key to the code would be able to decrypt or translate the email. Policy 5-103 prohibits sending PHI and PII using an unencrypted email to anyone outside of DSS. If the email address ends with @dss.mo.gov, then the recipient is inside of DSS. Any email address that does not end in dss.mo.gov is outside of DSS and requires encryption if sending PHI or PII. Before you forward or respond to a chain of emails, be aware of the entire content of the email and the type of discussion it contains. If you send the message out unencrypted, it's the same as if you had said everything in the email yourself. Policy 5-103 also specifies you must password protect any attachment prior to sending outside of DSS. Printable instructions on how to password protect a document can be found in the Resources tab of this course. Printable instructions on how to scan and remove hidden and/or confidential information from your documents can also be found in the Resources tab of this course. Now that you know which messages must be encrypted, let's take a look at how to encrypt an email. In order to encrypt an email, you simply have to type in a left bracket, the word encrypt, and a right bracket in the subject line of the email that you wish to encrypt. The information in the subject line is never protected, even when you encrypt an email, so never put PHI or PII in it. When there is a legitimate work or business need that requires PHI or PII be included in the subject line being sent within DSS, use only the minimum necessary information. Even when you encrypt an email, you must also password protect any attachments sent along with it. The Resources tab of this course has instructions on how to do this if you are unsure. Malicious software and viruses are a common threat in today's virtual world, and here are some do's and don'ts to help you protect PHI and PII. If you receive an email that appears malicious, contact the Office for Cybersecurity at cyber.security@oa.mo.gov or by clicking on the Report Phishing icon on your email toolbar immediately. Follow DSS policy and procedure when using email and the Internet. If you have a state-issued device, connect your device to the DSS network every 30 days for security and software updates. Contact your supervisor if you need assistance. Read the security reminders sent out from the DSS Security Officer and the Office for Cybersecurity. If you receive a suspicious email or a suspicious attachment, do not open it and report it to the Office of Cybersecurity or by clicking the Report Phishing icon on your email toolbar. Do not uninstall or disable any antivirus software installed on your DSS computer or device. Do not access personal email accounts on DSS computers or devices. If you think you have a virus on your DSS computer or device, do not attempt to fix it. When using your workstation computer, place your screens or displays in a way to prevent unauthorized viewing. Log off or lock the workstation prior to leaving it, as well as lock your doors and desk if appropriate. Portable state-issued devices must be encrypted. If you have questions about encrypted USB drives, contact your divisional security officer for more information. Keep portable devices out of sight and covered or locked in the trunk when stored in a vehicle. Transport portable devices as carry-on luggage if you're traveling. Whenever possible and feasible, DSS workforce members should ensure that any individuals who enter an office have a valid reason for entry. Visitors to a secure facility are required to sign in. DSS workforce members should escort any visitors if they must move through restricted areas. DSS employees should display state ID badges when appropriate. DSS policies are in place to protect the confidential information that we use when providing services to Missourians. Please take the time to read and understand the different policies mentioned in this course so that you can help us to continue to safeguard our data. All DSS employees have online access to these and other policies in the DSS Administrative Manual. If you need clarification regarding information privacy and security, you can reach out to your supervisor or divisional privacy officer for assistance. DSS employees who have significant exposure to health information will receive additional instructions related to their jobs. DSS workforce members should never share any work-related information or pictures on social media that are considered confidential or not public. Policy 2-119 provides guidance for employees regarding conduct on social media. DSS employees are prohibited from sending employment-related documents, files, and/or correspondence to personal email addresses or accounts, or retaining the information on personal devices. Links to the administrative manual, policies mentioned in this course, and a list of divisional privacy officers and their contact information can be found in the Resources tab of this course. There are 4 main DSS administrative policies that guide DSS workforce members regarding information security. Policy 2-119, Confidentiality, ensures compliance by workforce members and requires that they sign and understand a confidentiality agreement for the department. Policy 5-103 provides guidance regarding the security and protection of PII, or personally identifiable information, and HIPAA PHI, or protected health information within the department. Policy 5-104 dictates how confidential documents are to be securely disposed of. And Policy 6-100 provides guidance on how to manage information security in the department. Client rights. In this section, we will go over the rights that DSS clients have regarding their PHI and PII, as well as how to handle a request for an account of disclosures of confidential information. HIPAA and the laws governing PHI and PII give individuals certain rights over the confidential information that DSS maintains. All clients who receive services should get the DSS Notice of Privacy Practices regarding DSS and their confidential information. This document informs clients of the following information: the collection of confidential information in order to provide services, how a client's PHI and/or PII may be used, the client's rights regarding their PHI and/or PII. Knowing the client's rights enables you to be compliant with HIPAA and DSS policy. A link to the DSS Notice of Privacy Practices can be found in the Resources tab of this course. Clients have the right to obtain and to access copies of PHI and PII in their records. They can also request that DSS amend their PHI and/or PII on record. Clients have the right to receive information about certain PHI disclosures that DSS tracks. This is known as an accounting of disclosures. However, this right does not apply to PII. Clients have the right to be free from intimidation or retaliation. DSS workforce members may not intimidate, threaten, coerce, discriminate against, or take retaliatory action against any individual for exercising their rights under HIPAA or other confidentiality laws. For more details regarding client or individual rights, please see DSS Administrative Policy 5-103 in the DSS Administrative Manual or in the Resources tab of this course. As stated earlier, clients have a right to information about disclosures where DSS has released their PHI. Administrative Policy 5-103 details what disclosures are permitted and need to be tracked. Some disclosures and a list of the information disclosed must be recorded and tracked. DSS uses an electronic system to record tracked disclosures. If your daily job duties require tracking disclosures, you will receive additional instructions outside of this course. Divisional privacy officers can help you determine if the information you are disclosing must be tracked and can provide you with access to the disclosure tracking system to record the disclosure. Privacy has been stressed throughout this course and is the general rule regarding PHI and PII. However, there are times when DSS employees must disclose confidential information in order to do their jobs. First, let's go over what a disclosure actually means. Disclosure means releasing, transferring, providing access to, or divulging PHI or PII to parties that are outside of DSS. As a single covered entity, all DSS employees may use and share PHI and PII within DSS as necessary to do their jobs. When sharing PHI with other DSS employees, HIPAA requires that the information be limited to the minimum necessary. Best practice is to take the same approach with PII. Federal privacy standards require you to take reasonable steps to protect PHI or PII in either electronic or paper form. DSS also works with business associates that sometimes requires a disclosure. A business associate is a person or organization that assists or performs on behalf of DSS and may perform a function or activity involving the use or disclosure of PHI and/or PII. Examples would be for case management, claims processing, collections, and more. DSS employees may disclose to the business associate, subject to a business associate agreement, the PHI and PII necessary for them to perform their job duties and functions. To find out if your division has a current agreement with a business associate, contact your division's privacy officer. Breach procedures and enforcement. In this section, we discuss the process and procedures related to breaches and the enforcement of HIPAA. In order to avoid a breach, we need to first understand what a breach is. HIPAA defines a breach as the acquisition, access, use, or disclosure of PHI in a manner not permitted by the HIPAA privacy rule. This definition applies to both paper and electronic records. PHI or PII stored on a mobile device may be determined to be a breach if that device is lost or stolen and the information or device is not encrypted. If the PHI or PII on a lost or stolen laptop is encrypted, it is considered secure and will not be deemed a breach. DSS has a responsibility to monitor compliance with HIPAA and investigate breaches of privacy and security complaints. What happens when a breach occurs? DSS Administrative Policy 5-103 provides that if an employee inadvertently makes an unauthorized disclosure or becomes aware of an actual or potential unauthorized disclosure of PHI and PII by others or by the DSS computer system, the employee is responsible for immediately reporting the incident to their supervisor. Once a supervisor is notified of a possible breach, the supervisor will immediately assist the employee in completing and submitting an incident disclosure report and sending it to their division's privacy officer. Since September 2009, HIPAA requires that individuals be notified of any breach of their PHI as soon as possible, but no later than 60 days from the discovery of the breach. It is everyone's responsibility to report suspected HIPAA violations. HIPAA requires covered entities to respond to all potential violations. HIPAA requires that all covered entities have a security and privacy officer. At DSS, we have a robust team that oversees our security and privacy activities. To find your point of contact, you can refer to Administrative Policy 6-100, or you can visit the webpage dssintranet.mo.gov/itsd/privacy-officers. A printable list of DSS privacy contacts is also in the Resources tab of this course.